Before a PRP treatment, we are going to prepare the patient using topical local anaesthetic cream in the form of lidocaine, which is applied for 30 minutes, which makes the procedure a lot more comfortable. So we have our model here today, Louise, who has kindly agreed to have a PRP procedure performed. This is essentially platelet-rich plasma, which has fantastic results, particularly around by the eyes, where the skin is particularly thin and is prone to dark circles. The first stage of this procedure involves taking blood from the client, which I'm going to do now. Let's just pop a little butterfly here. Is that okay with you, Louise?
Mm-hmm.
Yeah, good. Excellent. So we're now placing the blood sample into the centrifuge. The idea of this is to separate off the red blood cells, leaving just the plasma, which is rich in platelets. And this will be re-injected into the patient. So what we've achieved with the first spin is a differentiation of the red blood cells and the plasma, which is rich in platelets. We're now going to perform a second spin, which will further enhance the concentration and the quality of the platelets contained within the plasma. Okay, so you can probably hear in the background the glow centrifuge machine, which is now going through its second spin, further concentrating the platelet plasma ratio. In the meantime then, we're going to prepare Louise's face. She's already had some local anaesthetic cream placed all over the face, which I'm going to wipe off and cleanse now, thereby sterilising the area before we begin to inject. Louise's main area of concern is around the eyes, which we'll focus on. And what we aim to do is to inject the most concentrated part of our solution around the eyes. That will still leave approximately 3 to 4 mils of platelet-rich plasma, which we can inject around the rest of the face. I intend to use a blunt cannula technique, so not using a needle, which reduces the amount of trauma to the skin. Okay, so just to point out that these were the areas which are often cited by women as a problem. The skin here is very thin, which means that it doesn't allow us really to inject fillers in this area, and Botox would not be the correct treatment for this because there's very little muscle there. So what we're looking to do is to rehydrate this skin, to provide nutrition to this skin, and also help in repair of this very delicate tissue. And this is ideally done using the PRP technique. We're also then going to use the remainder of our solution in areas such as the nasolabial lines here, and also some fine smile lines. Smile for me, Louise, across here. So I'm going to use a cannula technique to inject the PRP around the eyes. In order for the cannula, which is a blunt instrument, to enter the skin, we need to first create a small pre-hole. This is what I'm doing now. Okay, a little scratch there, and that's it, literally. That's all that is. Okay, perfectly fine. Now going to enter the skin. So you'll be aware that there's something going on here, Louise, but it shouldn't be too uncomfortable. And you can see there the actual cannula and where this actually goes to, just there, okay? And we're gently going to inject now. And we know we're quite superficial in the skin, forming a small bleb of liquid. This takes about 24 hours to settle down. Okay, that's beautiful. You okay with that?
Yeah.
Good. Any discomfort?
No, can't feel anything.
Okay, so we've treated the medial aspect of the skin under the eyes. we're now going to treat the lateral aspect here. Okay. And once again, the shadow of the actual cannula is visible, knowing that we're in the correct layer of skin. If you inject the platelets too deep, they don't have such an effect. You can probably already appreciate that the swelling has already started to diminish. Okay, that's that side there. Okay, and what we're going to do now is the opposite sides. So I'm going to swap over. Good, and you can see there that this original entry point and injection has already started to settle very nicely. Okay, and we're now going to address the nasolabial line here. So in total we've injected about 1 mil around either eye, and now we've got a remainder of about 4 mils in total, which we can use in other areas of the face and address other areas which are bothering Louise, in particular the nose to mouth lines and also some smile lines across here, some of which one cannot treat with traditional dermal fillers. And you can see the tip of my cannula there just by the nasolabial fold. We can happily inject in that area. So this is not a filler, this is something which is going to nourish the skin and help in tissue repair. Okay, and can be used in conjunction with treatments such as dermal fillers, which contain HA, and also Botox. So now we're going to address some of the smile lines. Big smile. Okay, so just really a little bit of PRP solution to be placed across here to help the quality of the skin there. Okay, so because this injection is being placed in the dermis of the skin, it can be a little bit uncomfortable, as we know that this is where the nerve endings are. So we're looking just to support the tissue where the muscle planes cross, and the skin tends to wrinkle when you smile. So we're looking just to support that tissue. And the beauty of this procedure, of course, is that we're using your own plasma, so this is natural. There is very, very little risk of any form of reaction occurring to the treatment, so that we know this is very safe. And that's paramount when having something injected in your face. And indeed, the technology behind platelet-rich plasma has been around for many, many years and is used by orthopedic surgeons and also by sportsmen to help in the repair of injured tissues. Good. And to get a full appreciation of the effects of this, Louise will be needing 2 treatments spaced approximately 4 weeks apart. And I'd encourage you to look at her photographs on the website before and after to see the full effects of her treatment.